Medical Student Education Series Core Orthopedics, all about bone tumours, Part 2. We're now looking at some malignant bone tumours. High-grade osteosarcoma, a young boy. These occur around the knee, around the shoulder. High-grade hemorrhagic, destroying the cortex, extending into the soft tissues. Heterogeneous matrix, lytic in appearance. Remember what we said in Part 1 about how a malignant tumour appears on X-ray? Well, here it is. Irregular borders, cortical destruction, lytic lesion, soft tissue extension. MRI shows it streaming across the physis. Histology shows immature osteoid tissue. Chondrosarcomas, you see these in adults. Proximal humerus is common. Speckled calcification, hot bone scan, resected, limb salvage, reconstructed with a hemiarthroplasty. Chondrosarcoma, older patient, complicated by pathological fracture, hemorrhage streaming down the medulla, close-up view of the fracture. This is X-ray prior to the fracture. Because of the fracture, this patient required amputation. Giant cell tumour, lower femur with a pathological fracture. An example of a tumour that is not malignant because it doesn't kill you, but it is locally destructive and recurs. X-ray shows local destruction. Tumour resected, knee arthrodesed over a nail. Another case, giant cell tumour, upper tibia resected, young male, limb salvage with a knee replacement and an allograft. Ewing sarcoma. This is a tumour that can present as an infection. Patient is toxic, unwell, and hot and tender area. So you have to differentiate it from an infection. Remember what we said, do cultures. It occurs in diaphysis, hemorrhagic, destructive, soft tissue extension, round, dark cells. X-ray shows typical features of a destructive lesion. MRI shows soft tissue extension. Resected, replaced with hemiarthroplasty. Multiple myeloma, most common primary bone tumour in adults. Plasma cells, presents with bone pain, back pain, lytic lesions. Lower femur, prophylactic fixation before the fracture occurs. Some benign lesions. Common one is a ganglion around the region of the wrist. Resect, can recur. Here's one that recurred in the small finger. Giant cell tumour of the tendon sheath. A male, occurs in the digits, scalloping indentation of the phalanx. Multiloculated appearance, resected, may recur. Other benign lesions, osteochondroma, common around the shoulder, knee, ankle. Resect. If it enlarges, suspect malignant transformation. Enchondroma, common in the hand, endosteoscalloping. Bone cyst with fracture. Remember what I said? Treat the fracture, then later cure it and bone graft the cyst. Lipoma around the shoulder may recur. However, these can become malignant. A liposarcoma, posterior thigh, young male, resected. Fibroma in the hand, resect. Fibrochondromatous hamartoma. This is one for the Mayo Clinic, extremely rare. Social aspects of bone tumours. Remember, this is the worst day of their life when you tell the patient the diagnosis, especially for the parents of a child. So make sure your information is accurate and check it carefully, and then deliver the information in a kind and sympathetic manner. Thank you for your attention, and please look out for All About Orthopedic Pathology in the same series.